You wake up, pull back the sheets, and notice something strange. One foot is perfectly warm. The other is icy cold. It is easy to brush this off as a standard byproduct of aging, but that localized temperature drop is a subtle, urgent signal from your vascular system. This demographic visualization maps out older adults in the UK. Exactly 20% of them, 1 in 5 people over 60, are living with peripheral artery disease, or PAD, often without realizing it. Because your legs and feet are the furthest points from your heart, blood has to travel the longest distance to reach them. This makes your lower extremities the first to reflect any drop in circulation. When these localized changes in the lower limbs are ignored, the underlying blockages quietly escalate, eventually impacting the entire cardiovascular system. Consider John, a 65-year-old former smoker. Recently, a severe cramp-like ache in his calf has begun forcing him to stop short during his daily walks. After a few minutes of rest, the pain fades. This pattern is called intermittent claudication. The pain occurs as the calf muscles seize from acute oxygen starvation during movement. John also presents with other persistent physical markers. His feet remain chronically cold, and the skin often takes on a pale or bluish tint regardless of the weather. Over several months, the skin on his shins has become unusually shiny, the hair has thinned, and his toenails have grown thick and brittle. These distinct changes, the cramping, the persistent cold, and the loss of hair, form a single connected timeline of progressive arterial starvation. This diagram shows a healthy leg artery with unrestricted flow of red blood cells. Over time, smoking and age accelerate yellow cholesterol plaque, narrowing the channel. During movement, accelerated blood flow bottlenecks at this buildup, starving the tissue beyond it. This lack of blood also deprives the surrounding nerves of nutrients. As they are starved, the nerves misfire, causing a crawling sensation, tingling, burning, or a heavy numbness in the feet. The physical percentage of the artery that is obstructed by plaque directly correlates to the severity of the pain experienced during movement. While arteries deliver oxygen down to your feet, a separate system of veins must fight gravity to return that blood back up to the heart. When this return system fails, fluid pools. Throughout the day, the ankles and lower legs gradually puff up, with the swelling peaking by the evening. As the blood struggles to move upward, the pressure expands the vessels just under the skin, creating the twisted, blue or purple varicose veins seen on the calves. This mechanical cross-section of a leg vein illustrates venous insufficiency. The one-way valves are failing to close completely, allowing fluid to leak backward and pooling downwards. Arterial disease represents a dangerous lack of supply. Venous disease represents a debilitating failure of return. Consider Mary, a 52-year-old managing type 2 diabetes. She gets a minor gardening scratch on her toe, but weeks pass and the small wound simply refuses to close. High blood sugar damages blood vessels over time. When combined with compromised circulation, minor scrapes are starved of the nutrients required for repair, turning simple blisters into deep, chronic foot ulcers. Certain symptoms require immediate medical intervention. A sudden shift in skin color to purple or black, or sudden, painful swelling in only one leg, are critical medical emergencies. Ignoring these specific signs increases the risk of deep vein thrombosis, localized tissue death, and amputation. A non-healing wound or a sudden color shift indicates that the local vascular system is entirely failing to support the tissue. Identifying these symptoms early leads to medical diagnostic tests that are painless, highly effective, and non-invasive. This split-screen graphic demonstrates an ankle brachial index, or ABI test. It compares blood pressure in a patient's arm to the pressure measured at their ankle. By comparing real-time numbers, doctors prove blockages. A significantly lower ankle number confirms restricted flow. The next diagnostic step is a Doppler ultrasound, which allows vascular specialists to visually map the vessels and pinpoint the exact location of the restricted flow. This investigation transforms a distressing physical symptom into a measurable, treatable mechanical problem. Treatment involves immediate lifestyle interventions, quitting smoking, managing blood sugar, and elevating legs to assist gravity. Doctors often prescribe a supervised, gentle walking program. This encourages the body to build new, healthy collateral blood vessels that naturally bypass the old blockages. With clinical care, diet control, and guided exercise, patients like Mary and John see their ulcers heal and their mobility restored. By acting on the early signals in your legs today, you protect your mobility and your cardiovascular health for the future.